Hello, I'm Orion Rogers. I'm the Environmental Health Director for Southeast Utah. I have also been assigned the position of Incident Commander for the Grand County COVID-19 Task Force. The task force is a group of individuals from the different agencies within our area. As of today, that command force is set up of members of the Sheriff's Office, Emergency Medical Services, the Fire Department, Moab Regional Hospital, Grand County School District, Grand County, Moab City, Moab Police Department, the National Park Service, and Utah Highway Patrol, as well as the charter school. We have implemented a unified command structure where each of these different entities plays significant roles in planning and operations, logistics, and financial aspects of the command structure. With me today are a few members of that task force. We have Taryn Kay from the school district, Chris Baird from the county, Joel Linares with Moab City, Carrie Marinelli with the charter school, and Jen Sadoff with the hospital. As of today, there are no reported cases of COVID-19 in Carbon, Emory, or Grand counties, but there are 6 in the state, which is an increase since yesterday. These cases are located in Summit, Salt Lake, and Davis counties. So the goal of the task force is to help slow the spread of the coronavirus COVID-19 disease. What we're trying to get to our public is that an important message to help us flatten that curve. As part of flattening the curve, and let me kind of explain that. The idea is that if we get a lot of cases of COVID-19, our medical institutions are going to struggle to take care of all of those patients. If we are able to slow down the spread of COVID-19, the medical institutions will be able to help keep up and provide necessary services to those people who become ill. The closure of institutions is imperative in mitigating the spread of the virus because it increases social distancing. Social distancing is shown to be the primary way to combat the spread of COVID-19. As of today, all city and some county buildings are closed to the public. The city and county officials will elaborate further on that later. Beginning Monday, all students in Grand County School District and in the charter school are dismissed from school for 2 weeks. The school district will provide further updates on that. What I want to bring home with this is that the public is our greatest asset in the fight. We need our community to practice social distancing. If you can stay home, please do so. If you need, we need everyone's partnership in prevention. Wash your hands. Don't go out if you're sick. Certainly don't go to work if you're sick, even if you're able to work. If you're over 60, don't congregate in groups over 20. If you're younger and well, avoid groups over 100. Ideally, avoid groups in general and stay 6 feet away from people. We cannot emphasize any further or any more that it is important to socially distance, wash our hands, and stay home. I am going to now introduce Taryn Kay with the Grand County School District to give an update on what's happening at the school district.
Hello, my name's Taryn Kay. I'm the next superintendent for the school district and the superintendent actually in charge of handling the coronavirus situation. And the relevant information is that as of 4 o'clock today, Governor Herbert held a press conference with Superintendent of State Schools, Sidney Dixon, and they announced that effective Monday, schools across the state of Utah will be in a new term dismissal for 2 weeks. At the end of 2 weeks, they will reevaluate that, and either they will continue the dismissal or we will welcome students back. I know this is going to create many questions for parents, so just a few of the issues. The staff in the state for education has been given 2 days, Monday and Tuesday, for planning purposes. During that time, they will be planning the implementation of distance learning options for parents and students, and that will be operational by Wednesday. And during Monday and Tuesday, parents can expect to hear from their schools regarding picking up a Chromebook to use at home for the duration of the dismissal. Emory Telecom has today announced that any students or any family who doesn't have internet access already, they will provide free internet access and a free phone line through the duration of the school closure or the school dismissal. We really appreciate Emory for offering that. More details will be coming about that. We will have students who qualify for free and reduced lunch be able to come and pick up their lunches beginning Wednesday. We are also exploring ways to deliver lunches to perhaps bus stops, other mechanisms. We will provide more communication about that on Monday and Tuesday. No lunches will be available Monday or Tuesday, but beginning Wednesday, we'll have that in place. And each school will be in contact with its parents on a regular basis to update you about anything that's happening. Please be assured that services for students with disabilities will continue. IEP meetings can still be held. Special education testing can still occur. And we will be delivering instruction via electronic means so that instruction isn't disrupted for students. We are hopeful that the state will not require us to make up any of these days in the summer or during holiday times, and we feel if we provide rigorous enough education during this dismissal that they will honor that and these days will count. We are available and open for any questions or comments, so please email us, call us with any questions, and I will also be here at the conclusion to answer any questions. Thank you. I would like to now introduce Carrie Marinelli, the director of Moab Charter School.
Thank you, Taryn. I'm Carrie Marinelli, the director of Moab Charter School. We echo what Grand County School District is doing to support our students during this time of a school dismissal that has been directed by Governor Herbert and State School Superintendent Sidney Dixon. Starting Monday, Tuesday, no students will be reporting for 2 weeks. We will provide distance learning, of which our school, that is a team, will be developing on Monday and Tuesday. So stay tuned for an email and on Facebook for what we are planning to do with our school, but we will be providing services. Thank you. Next is Jen Sadoff with the hospital.
Hi, everybody. My name's Jen Sadoff. I'm the CEO at Moab Regional Hospital. We just want to say thank you to everybody who's reached out with offers of support, from bringing masks down to volunteering. I think in this time it's a scary time. It's an uncomfortable time. There's a lot of things in flux, but working together with this group of people, I can assure you that this community will pull together to meet our community's needs, whether that's outside the hospital or inside the hospital. And I especially want to thank our nursing staff and our physicians and our admission staff and our housekeeping and our dietary staff who, while everybody else is social distancing, is going to be there for our community, taking care of them if they need it. We need your help in keeping the residents of Canyonlands Care Center, probably some of the most vulnerable people in our community and attached to our hospital, safe. We need your help in keeping our healthcare workers and our patients safe. And what that really means is not coming to the hospital if you don't have to. We are looking at canceling elective surgeries for the next several weeks. We have transitioned our family practice clinic so that we've canceled our wellness visits there so those physicians can be available in the emergency room and in our med-surg unit, and in our evaluation tent located outside of the ER. If you have any respiratory symptoms, and Dr. Cole is here and can go over those in more detail, we don't want you to come to the hospital without calling our hotline first. And that number is 435-719-3998. There is a nurse navigator on the other side of that line who will navigate you to the appropriate part of the hospital to be seen. That being said, if you are having difficulty breathing or severe symptoms, please call that line and call 911. They're prepared to navigate you, and let them know what symptoms you're having. I think Dr. Cole will talk a little bit more about COVID-19 info in terms of signs and symptoms. We do want you to know that we will be limiting visitors to the hospital to see patients to 2 at a time. We are also limiting visitors to being over 18 years old. And some exceptions can be made in certain cases of obstetrics and hospice, but in general, we'd prefer people under 18 to not be at the hospital unless they have an appointment with a provider. As I said earlier, our family practice is rescheduling, but if you have something going on, please do not hesitate to let the receptionist know when they call you that you would still like to see your provider. If you need a prescription refill, let them know that, and they will make sure to take care of you. We are still open for business for people who do not have COVID-19, and we want to make sure you're taken care of. Other than that, you know, we feel very ready for what is the possibilities ahead. We have ideas in mind for how we'll handle surges in patients. We have equipment arriving for transferring patients that's specialized, and we're looking for ways to set up telemedicine to keep people's connection with their providers happening during this time. So we're here for you. If you have any needs or questions, you can always give me a call at the hospital and ask for me. We do ask that you keep the coronavirus hotline available for people truly concerned about having the coronavirus. Please don't use it as a complaint line for the hospital in general. Let's keep it open for people who need to use it to navigate healthcare. Thank you so much. I'd like to introduce Chris Baird, the county administrator.
Thank you, Jen. Thank you, Orion, for all your hard work. Chris Baird from the Grand County Council Administrator's Office. I just want to give an update on the status of the courthouse. As of now, the courthouse doors are still open, but please be advised that several offices have begun to operate remotely, and we probably will only accept payment electronically or via the phone. Also, the Grand County Library is closed until further notice, and senior socialization at the Grand Center has been suspended. Just also wanted to let everybody know that the Moab Area Travel Council has placed 13 hand washing stations around downtown Moab and one over by Swanee Park. So I encourage the use of those. I also wanted to let everybody know that I've been working with the staff of the Grand Center, and we are going to provide assistance to the community for those who are at risk or who come down with mild cases of coronavirus, grocery delivery and supply delivery. And I'll come out Monday with a phone number for those services. I think that it's important that we support and provide infrastructure to accomplish the mission of social distancing, and especially to make sure that those who contract COVID-19 are able to isolate themselves at home and recover without exposing anybody else. Thank you, and I'll invite Joel Linares from the city to speak.
Thank you. I'm Joel Linares with the City of Moab. I'm the city manager. I'd like to thank this group, this task force first. They've come together and their leadership has been great throughout this whole process. And I really want to thank Chris for getting ahead of it and being the lead initially and taking the reins when this needed to be brought forward. So at this time, City Hall is open for business, but it will be closed to the public. City staff will be in the building. We will be working. Numbers have been posted online. They have been posted in our window out front. You can call and make a phone appointment. You can still get a hold of anyone you need to within the city. We're still processing all of our applications and everything like we normally would. We're just not open to the public at the time. We're going to have a closed City Hall structure. Our pool, the MARC, the MRAC, and the gym are currently closed, and they will remain closed through this process and through this task force. We will work with this group to evaluate that and at a later time make a determination when it's proper for us to reopen those institutions. It is very important that we flatten out this curve and help Jen and the hospital not get overrun as we go forward, and we need to do our part to keep the numbers of groups of people down into small numbers, and we're going to do that by closing those facilities temporarily until we get more information at a better time it is for us to reopen them. That said, I just want to reiterate, Moab City Hall is functioning. It is operating. Moab is open for business. We will continue to provide all the essential services that everyone will need through this process, water, sewer, law enforcement. All of those things will be delivered, and they will be delivered without a hitch. So I want to thank this group once again, and I'm going to hand the time back over to Orion and take questions.
Before we take questions, I just want to reiterate that the health department's working hard on this. This whole team is working hard on it. The number of hours that have gone into these preparations over the last week, 2 weeks, I can't even count how many hours probably between all of us. So we're out there, we're working for you. We need our public to partner with us and use those previously mentioned practices of social distancing, hand washing, staying home when you're sick. And anyway, beyond that, we also have Dr. Cole from the hospital here to give us a description of what those symptoms are that we're looking for. After Dr. Cole has given us those descriptions, we'll open up the room to questions from the media.
Thank you, Orion. So I'm Dylan Cole. I'm the Chief Medical Officer at Moab Regional Hospital. And I just want to reiterate that we are in the preparedness phase right now. We are ramping up our capacities and making preparations among all of these organizations to do two things. One is to maximize our ability to take those community mitigation strategies that we've all been talking about in order to flatten the curve and slow the rate that this pandemic could affect us here locally and regionally in terms of medical capacity. The most important thing there, as Jen Sadoff mentioned, is that we are really attentive to the fact that for the most part, the majority of people that get this illness will have mild symptoms similar to the flu. Those symptoms most typically present as fever and cough. Fever is present in at least 80% or so of cases. Cough also in the great majority. Symptoms such as upper respiratory congestion, stuffiness, sinus-related symptoms are quite, while they rarely or sometimes occur, they're quite less frequent. Shortness of breath certainly is seen, as can be flu-like body aches. So it's best thought of as a flu-like illness. And again, the important thing for the entire community in terms of how do we face this together is that the majority of those patients with mild symptoms self-isolate and stay home. Not everyone who has mild symptoms can, should, needs to be, or can be tested. Testing capacity remains limited, and we're working closely with the state, with the CDC, with the health department in terms of staying on top of what those guidelines are in terms of testing capacity. The hotline that we've established, which Jen mentioned, is your point of contact, and it is important to keep the facilities of our local hospital open and not overwhelmed with patients with mild symptoms. As Jen mentioned, we have restructured many of the operations at the hospital, have, again, at this point in preparation for what is anticipated to be a significant upswing in the numbers of patients that we may be seeing and dealing with respiratory symptoms. We have a small medical staff, small nursing staff, a small team entirely at our 17-bed critical access hospital. We are restructuring operations there significantly this week to create capacity so that we're ready to handle that. I think we are ahead of where many similar hospitals are. I'm very confident of that, confident of the preparations we're taking. Nonetheless, we all know, if we're paying attention to the way this illness is affecting health systems in other parts of the world, in Europe, et cetera, that it can still become overwhelming. So the most important thing are the community mitigation strategies, keeping space, staying at home, self-isolating, et cetera. And yeah, we're happy to take questions.
My question is, what threat to this goal of flattening everything out to all tourists walking around town right now put on us?
It's impossible to quantify what that increase. Oh, can I repeat the question? Sure. The question is what additional risk does the tourism industry pose on our community having tourists come in from other areas? Correct.
And it's packed.
Say that again.
It's packed.
It's packed. Town is busy. It is certainly a concern of ours to have so many visitors from outside that we don't know where they're coming from and what they may be carrying as disease. That's another reason that we need to do this social distancing thing, try to avoid those busy places. With people comes disease, and it's easy to say that certainly tourism does increase our risk within our community. Yes.
Carter with the Time Independent. This might be a question for Chris or for Joel. There's state guidance right now against gatherings larger than 100 people. Are there currently any such guidance or regulations that's specific to the city or county? And if not, might businesses and event planners expect such regulations from the city, county, or even health department?
So at this point in time, there are no official requirements from the county, but we have been making recommendations to any future events. So I think that there's only one event that hasn't canceled that's imminent out at Building Man, which is near Green River, and I'm not sure of the status of that event at this point. But the rest of the events have canceled that are in the imminent future, a week or two out.
Does that include Jeep Safari?
No. So as my understanding, Jeep Safari has canceled their expo and their barbecues, but the trail rides are still anticipated. I think that Grand County is going to defer to the health department on the question of whether or not we should cancel any element of an event.
And I would echo Chris on that. We also would defer to the health department and their leadership. We would also adhere to what the state's advising us to do, and when the state lays down those guidelines, we would follow them.
As of now, those guidelines are state guidelines. Depending on how things progress, there is the potential of an order from the health department to, that there's the potential of canceling events or requiring those social distancing guidelines that were put out by the governor. Many people are concerned about the car show coming up. I'm in direct communication with the coordinator of the car show. It's 6 weeks out. We had a conversation this morning about not canceling just yet, but seeing where things go in the next couple of weeks and reevaluating at that point.
We do. We are still going to prepare lunches for all of the free and reduced lunch students, and that will be operational as of Wednesday. We just need the Monday and Tuesday to actually purchase the food because it's a whole menu change. If they had something like spaghetti planned, that doesn't travel well. And so we would do more a grab-and-go idea, which would be sack lunch. And we're working actually with our bus drivers, our transportation department, to potentially deliver those sack lunches to bus stops. We have FERPA regulations that would not allow us door-to-door delivery for student confidentiality purposes, but we are thinking maybe bus stops would be okay, and every student lives within walking distance of the bus stop by nature. And we're hoping, I've been in direct consultation with both our food nutrition and our transportation department, and they're going to be ready to have that operationalized by Wednesday. So there'll be like a window of, this bus stop between 11 and 11:15. The bus driver will pull up, maybe not in a bus, but like a Suburban, and have the lunches available for students at that stop, and they could come and pick those up. That's our plan right now. If that changes or broadens, then we will go ahead and announce that via Facebook, website, parent link, all of those things.
Moab Charter School contracts with Grand County School District for their food services, and so we will be echoing their plan and doing our very best to still provide those food for our students.
Hi, this is a question maybe best directed to Orion, but for businesses that are looking for guidance about whether they should close, how they should be handling customers, that sort of thing, where should they go for that guidance? Who should they ask?
Businesses can reach out directly to us at the health department. We're manning the phones as best we can. Currently, we have myself and another environmental health scientist, Jonathan Dutrow, that are fielding those calls and providing that guidance. We are also have sent out guidance to our restaurants as of today on reminding them to continue doing their best management practices that are always required of restaurants, because we recognize that is a location where people are coming together as groups. And so we've asked those restaurants to really up their game when it comes to sanitation and food safety practices. Yes.
This is an observation as much as a question. I've been looking at the Spanish flu, 1918 in Moab. 2 people died. A lot of men died in mining camps, and the Navajo Nation was just decimated. But Dr. Williams, he's making people wash their hands. He was making them stay home. And when it got so bad, they had deputies at both ends of town with shotguns, and you didn't come into town. That's a scenario that you can see happening if this take hold.
Sure. I mean, we're going to take whatever means are necessary to protect our public from the spread of this virus and disease. And sometimes those measures can be very drastic. If you're to look at Title 26A, the powers and authorities of health departments, I think many people would be very surprised to understand the capability, the powers that we do have as a health department. We can, like we've talked about, the canceling of mass gatherings can occur. We can quarantine people. We can isolate people. Those are extreme measures. For now, we want to work with our public in order to protect their safety. However, more drastic means could happen depending on the situation at hand. And everybody seems to think we have a magic crystal ball we can look into, but we're just doing our best to mitigate this.
I think you guys have all done a great job.
Thank you. Any other questions? Yes.
I'm not planning on furloughing anybody in the next 2 weeks, but we are certainly looking at ways to cut our budget. As you can imagine, our revenues are going to be greatly diminished. And so I am going to have to look at potentially furloughing employees or redesignating them. Right now, I've mobilized the Travel Council, the Senior Center, and the staff at the Old Spanish Trail Arena to respond as necessary to help mitigate COVID-19 and to provide support to the community. So that's my plan at present.
For the city, we don't anticipate much of a decline in services as we go forward. We think that we can provide the level of service from behind the closed door aspect is about as good as we are doing currently. So the goal right now is to get through the next two weeks to a month and then reevaluate where we are. We have taken steps to track our spending, track what we're doing, and we're keeping tabs on everything that we are doing. So when the time comes to do the emergency management side of things, we're prepared to make those claims as well.
Thank you very much. One small follow-up would be, do you guys anticipate this impacting city and council continuing to have functioning open meetings?
I've discussed it. Under the declaration of local emergency, there is the possibility that the council could delegate executive functions to me, and they would still be required to pass legislation or legislative actions. And if it comes to it, I think that we may have to postpone those actions. And so we've been considering that.
Like Chris, we've also done our research and looked into if this gets worse, what we're going to have to do in order to keep the government functioning. Currently at this time, we don't anticipate suspending those. We anticipate having meetings at this time. We'll see how that goes forward. You know, we have the ability to broadcast, as does the county. So even if we were holding public meetings that were noticed to an empty room and everyone watched from home, and that would be a possibility. We have concerns if it got worse of even having some of our council members gather together. So as this goes further down, we'll reevaluate and we'll make decisions as appropriate.
Are there any further questions? It looks like there's no more questions. Again, let's remind you, social distancing, hand washing, stay home if you're ill. And thank you all for your time, and we're going to keep you as posted as we can and recognize that we are out there working really hard, and if it feels like there's any communication breakdown, just know it's because we're working hard, but we're going to strive to communicate as best we can.